Last night I brought you an interview with Sydney University Emeritus Professor Diana Kenny, one of the brave medical experts speaking out against what's probably the worst medical malpractice in decades. And that is the apparent conspiracy between well-funded trans lobby groups and some government-led health facilities, allowing confused children to make irreversible decisions to change their bodies. Now, we don't allow minors to vote, to drive or to smoke or drink alcohol because we say they're not sufficiently mature. Yet we allow some of them to decide that really they're boys trapped in girls' bodies or vice versa. And on that basis, to take puberty-blocking drugs and to even have surgeries that will change their bodies and lives forever, even though many of these children have mental health issues that are driving their gender confusion, as Britain's landmark Cass review concluded 2 years ago. Yet here in Australia, whistleblowing doctors and scientists are being punished rather than commended for their courage and integrity. As viewers would know, Dr. Gillian Spencer has been stood down from her work as a hospital child psychiatrist in Queensland. And James Cook University psychiatrist Dr. Andrew Amos has had his right to practice threatened by his own professional association following complaints about social media posts. Well, last night on this program, Professor Kenny didn't miss.
These transgender activists are acting more like people in cults or religious sects behave rather than scientists or medical professionals. Well, we're not delivering the right message. The right message is that some children are born in the wrong body and that boys can be girls and girls can be boys. And because we're not going along with a message of that kind, we've been ostracised, marginalised, criticised and persecuted by our professional organisations.
I told you she was strong. Now, as you know, in Britain, giving puberty blockers to minors and body mutilating surgeries been all but stopped after the Cass review found there was no sound evidentiary basis for these treatments. Instead, they focus on mental health interventions, the sort of interventions we have when a young person presents with a body dysmorphia disease like anorexia. Now, we don't just agree with anorexics that they're fat. We address their underlying mental health concerns and we help mend their physical state. Yet not so if that dysmorphia relates to gender. Instead, we refuse to update statistics in this country. We push kids down a pathway of life-altering changes. We keep parents in the dark. We don't even keep the basic health statistics that are mandated for almost every other medical condition. And if we don't keep the statistics, ask yourself why. What are the gender medicine zealots wanting to hide? What don't they want you to know? Today, former Liberal health ministers, including, of course, former Health Minister, former PM Tony Abbott, called for an urgent independent inquiry and demanded that the data be made public. Now, without a doubt, this is a scandal. And as more and more brave medicos are speaking out, the pressure's building on the government here in Australia for our own version of the Cass inquiry.